Welcome to the second webinar in the series Supporting Students with Vision Loss. Thank you so much for joining me today in this three-part webinar series. If you missed the first webinar, we cover the definition of vision loss versus blindness, and common eye conditions. Before I start, I'd like to do an acknowledgement of country. I would like to acknowledge the Aboriginal and Torres Strait Islander peoples as the first peoples and traditional owners and custodians of this land and waters. I pay my respects to the ancestors of this country, elders, knowledge holders and leaders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples. I would like to acknowledge the elders past, present and emerging of the Turrbal peoples who are the traditional owners of the land and waters on which our Bald Hills office is located. So just to quickly cover this again, if you missed the first webinar, my name is Karen and I am an ex-teacher with about 20 years experience working in schools both in New South Wales and Tasmania. I am now an orientation and mobility specialist as I now work for Guide Dogs Queensland, and I've recently completed the Masters of Disabilities, Sensory Disabilities. If you were wondering what O&M stands for, it's orientation and mobility. So orientation is where you are in your environment, whether or not it's at home or at school or your workplace, and mobility is moving around. So my main goal is to help clients move around independently from point A to point B. All right, today we will be covering adjustments for students in the classroom. This is where we get into the practical aspects of creating a welcoming and accessible learning environment for children, and honestly, one of my favourite topics. These adjustments are recommendations that have been compiled by our orientation and mobility specialists, our occupational therapists, our assistive technology specialists, and our psychologists that have been working with students with low vision or blindness. Please consider that these are general recommendations in this webinar that can be used with other students in your class that may not have low vision or blindness. Today we will be covering assisting a person with vision loss, assisting in group situations, tips on guiding safely, routines-based intervention, hand-under-hand tactile strategies, visibility of print, factors affecting near vision, removing background distractions, incidental learning, alternative format library AFL, slope boards, bookwork, visual fatigue, light-dark adaptation, encouraging use of prescription glasses, self-advocacy, visual scanning, sport, physical education and games. Firstly, assisting a person with vision loss. You should never assume a person with vision loss requires assistance without first asking them, would you like help? Always, please, always introduce yourself, even if you've met the person before. They may know who you are, but they may not recognize your voice alone without context. You don't need to raise your voice, just speak clearly. If you must move away while talking to a person with vision loss, tell them you are leaving the conversation so they're not left talking to themselves. It is okay to use words like see, look, and watch in general conversation. People with vision loss use those words themselves. If you're giving directions, use phrases like behind you on your left or in front of you to the right. Also, using a clock face to the features of a room can be useful. For example, the door is to your right at 2 o'clock. Remember that 12 o'clock is directly in front of the person and 6 o'clock is directly behind the person. General terms like over there or that way aren't helpful for a person with vision loss. Provide verbal descriptions of what you are pointing to or referring to. For example, please collect your marked workbooks from over there. Could be changed to, please collect your marked workbooks from the top of the cabinet beside the bookshelf. Try to inform a person with vision loss if you give them something. For example, if you give them a drink, say, "I'm putting a cup next to your right hand." Assisting in group situations. If you are in a group of people and you are aware a person has vision loss, tell them the names of the people in the group. Clearly use each person's name when you talk, so it is clear who is speaking and interacting. If you want or need information from a person who has vision loss, ask the person directly. Do not ask another person to answer on their behalf. I've had this happen many times. For example, when I've been out with clients who have learnt a route to the bank, for example, the employee looks at me and asks me if they want help, as if the client is invisible. Please look directly at the person and speak to them as you normally would with everyone that you speak to. Tips on safely guiding. People with low vision or blindness sometimes require assistance to move safely through their community. The aim of providing guidance is to assist a person when needed so they can travel confidently and efficiently in certain situations. These can include general travel and more specific instances like using escalators or getting into vehicles. Remember, as I've already said, not every person with low vision or blindness will need this type of assistance. Remember, please, you should always ask the person if they need help before providing them with any assistance. As I've already said, always start by introducing yourself. They may know who you are, but they may not recognise your voice alone without context. You don't need to raise your voice, just speak clearly. Please, never just go up to a person and grab them. Imagine if you were standing waiting for a bus and a complete stranger came up to you and grabbed you and started dragging you along. You would not enjoy it. Now imagine this with your eyes closed. I'm sure you would feel overwhelmed and possibly scared. So remember, always introduce yourself and ask permission first. Step 1, establish contact. In these graphics, the person with low vision is white and the person guiding is orange. Ask the person with low vision or blindness if they need assistance. They may not require a helping hand, but if they let you know that they do, make contact by touching the back of your hand against the back of theirs. This is a signal for them to take your arm. Grip. Let the person take hold of your arm just above the elbow, with their 4 fingers on the inside and their thumb on the outside of your arm. Their grip should be firm but not tight enough to cause you discomfort. Alternative grip. Gripping your wrist may be more comfortable for a child or where there is a substantial height difference. Stance. The person you are guiding should also keep their arm relaxed, bent at about 90 degrees and held close to their side. The person guiding should also have a relaxed arm. This leaves a small space between you both and allows for reaction time when you are walking. This also, importantly, gives control to the person with the low vision, as they can let go when they are feeling uncertain or if they want to stop walking. Walking. As you walk together, it can be helpful to alert the person you're guiding of changes in the path ahead. Please remember, communication is important. This could include obstacles like overhanging branches, changes in direction, or differences in the flooring. An example is, we're walking along the footpath and we'll be turning right soon. Or we are approaching a set of stairs that are ascending or going up. Routines-based intervention. Concepts, skills, and techniques are embedded within naturally occurring activities that occur throughout the student's day, both at home and within the educational setting. This provides meaningful and repeated learning experiences for the student. Students learn and practice their skills in the places they will use them. The focus of routines-based intervention is to support those who interact with the child on a regular basis, as the majority of the students will be learning in between the O&N visits, the OT visits, the AT visits, and the site visits to the schools. Hand-under-hand tactile strategies. The use of hand-under-hand is a non-intrusive technique which allows a child to always maintain control of their hands. It is where you place your hand under the child's hand or wrist to guide their hand towards an object, perform an action, or to introduce a new object. When you use the hand-under-hand technique, your hands perform the activity while the child's hand rests on top. In this way, the child can feel what your hands are doing. If the activity is new to the child, they may feel more secure touching your hands rather than the unknown object or activity. As you perform the activity, verbally describe what you are doing with your hands as the child feels your movements through their palms. You can gradually move your hands away, leaving the child to touch and explore independently. For children who have low vision or blindness, extensive use of hand over hand, that is, taking of their hands and having them manipulated to perform an action, may lead to tactile withdrawal and anxiety around not having control of their hands. It may also result in a child being a less active participant in learning tasks and routines as they learn to wait passively and rely on others for physical manipulation. Offer shared tactile experiences to help a child become comfortable with having other people's hands in close proximity. If a child has difficulty keeping their hand on top of yours, you can use a gentle touch to keep it in place, or gently capture the child's finger or thumb, ensuring they can still pull away if they choose. Please be patient and consider the child's physical and motivational needs when using this approach. Visibility of print. Generally, near vision will be affected when an eye condition exists to cause low vision. Near vision is a measure of the smallest print size that can be seen at the normal reading distance. However, this print size is not sustainable for prolonged reading when vision is impaired. If the vision loss is severe, the likelihood for assisted, useful reading, that is, reading for speed and meaning, with low vision aids, large print and assistive technology, is reduced. This is because a major deterrent for children learning to read is the effort that they need to put into seeing the letters and words, and the resulting visual fatigue. A decision regarding Braille should be made early in the child's literacy life. Some children become dual media users. This means they will use a combination of media to access print, such as large print, low vision aids known as LVAs, and Braille. If the enlarged size doesn't become too impractical, large print gives a child access to reading, and access means learning. School-age students usually will be able to report what size print they prefer. Factors affecting near vision include lighting, font size, font type, paper colour, paper finish, and background complexity. Lighting. Bright, evenly distributed overhead lighting maximises vision. A child should not sit in their own shadow. Additional lighting from a nearby lamp may also help. Although with some eye conditions such as albinism, additional lighting can hinder their vision. This is one reason why knowing the eye condition or diagnosis is important. Font size. Functional near vision testing finds the smallest print size read at any distance. The smallest print size read at 30 centimetres, and then the most comfortable print size for the student. The font size that is recommended for the student is usually double the most comfortable size. For example, N10 on a near vision test, the student would trial using enlarged print size N20. The font size must be sustainable for the student throughout the day and into the night for homework and reading. This provides the student with ease of access and takes into consideration visual fatigue that is not apparent in a test or clinical setting, as the test is quite quick compared to reading a book. Font type. A font that has closely spaced letters and closely spaced words will be harder to see. Arial and Vedana tend to be the easiest to see. Remember, even if the font size is the same, it could still be different depending on the styling. Paper colour. Provide good contrast between print and paper while minimising glare. Black print on white paper gives the best contrast, but white paper can actually be quite glary, which is a major problem for students with ocular albinism or cutaneous albinism. It is very difficult to read as white paper is very reflective of light. Buff and green paper have less glare as they are not as reflective. Paper finish. Gloss paper creating glare. Matte finish for laminating sheets is best compared to glossy sheets, but be aware that the matte sheets can lose the quality and clarity of the print when laminated. Background complexity. As the background becomes more complex, the visibility of print decreases. A plain background is best. For example, the patterned duck on a complex background is more difficult to see than the plain duck on a plain background. Some books have text overlaid with pictures, so this is something to consider. When presenting worksheets, try to remove as much clutter or unnecessary images, pictures and symbols from the page. Visually simple worksheets reduce the amount of scanning and interpreting the student is required to complete. In this picture, the student is holding the book very close to be able to read the N10 size font. All students need to be given the opportunity to be able to read at a comfortable reading distance. This child would be experiencing visual fatigue as he tries to read along the lines and tries to find the paragraphs. All students need to be able to access literacy in a comfortable manner. Practical tips. A busy, visually cluttered classroom may be very confusing for a student with low vision, especially if they have CVI, cortical or cerebral vision impairment. Minimising the amount of colourful posters, etc. near the main board may assist the student with low vision. Many primary classes have art and other work hanging throughout the class. This may be distracting for a student with low vision. This will improve the quality of near vision and their sustainability. The student should be involved at every stage of the selection, which includes font size, paper colour, etc. Assistive technology, large print and braille are all very vital considerations in providing accessibility to literacy. Removing background distractions. Distractions can be auditory or visual. Children with CVI may benefit from additional quiet study time in a library or other quiet space. It needs to be both clear of visual clutter and auditory noise. A regular room may not always be possible, as schools often require all their space. It may be necessary to timetable different rooms for study. Incidental learning. A significant amount of information is obtained visually. If the student's ability to gain visual information is limited, it is important to describe or comment on what is happening around them. Asking a person with low vision or blindness to walk around the class and hand out work, paper, pencils, etc., may give them an opportunity to know who is in the class and where their classmates are sitting. If you are wanting to gauge whether a student is able to interpret or read material, it is best to ask, "What can you see?" as opposed to asking, "Can you see that?" "Can you see that?" is a closed question and often results in the student just saying yes, as opposed to describing their vision and opening up the conversation to discuss their preferences. When completing in-class activities that require students to locate something quickly and then putting their hand up to answer the question, please be mindful that students with low vision can take longer to scan and locate the answers. This is especially important when working with time-sensitive online quizzes such as Kahoot. The Department of Education Queensland AFL produces and loans a range of alternative format learning materials in braille, large print and audio. They have tactile kits, picture books for literacy, tactile resources for science, mathematics, music, humanities and social sciences. 3140_AFL@eq.edu.au to request production and or the loan of learning materials. A catalogue from them is available on request. Students can also join their local library on the BorrowBox app to borrow ebooks and audiobooks. Some schools at the Department of Education Queensland use the Sora app, SORA. And Braille House in Brisbane has a library of books converted to Braille that students may borrow. Bookwork. Dark lined paper may assist with note-taking for a student with low vision. Sometimes using thick pens such as texters may assist the student to see their own writing. More time for written exams and assignments may be needed. Bookwork. Dark lined paper may assist with note-taking for a student with low vision. Sometimes using thick pens such as texters may assist the student to see their own writing. More time for written exams and assignments may also be needed. Visual fatigue. Classroom activities could be organised to break up visually demanding tasks. A mixture of dictation and board work is recommended. Encourage students to close their eyes when planning written work or when thinking. Be aware that conditions such as nystagmus causes a student's vision to fluctuate throughout the day. Nystagmus increases when a child is unwell, anxious or tired, and their vision may decrease at this time. Light-dark adaptation. If a student has difficulty quickly adjusting to variations in levels of lighting, it is important to allow them sufficient time to allow their eyes to adjust. This is a common symptom of retinal problems. Momentary blindness when entering or leaving a dimly lit classroom can be potentially hazardous. Encouraging the use of prescription glasses. Generally, wearing prescription glasses improves vision and stimulates visual development. The student should be encouraged to wear their glasses as prescribed. Transition lenses may assist the student by reducing glare in the environment. It is important that glasses are kept clean and scratch-free. Intermittently checking the student's glasses and encouraging them to look after the lenses will ensure the glasses are providing the best correction. One of the sayings I've always said with primary school children is, put your glasses on your face or in the case. Self-advocacy. Encourage the student to tell others when they are unable to see items of interest in the environment so that appropriate adjustments can be made. Visual scanning. Scanning is the ability to search for a particular item amongst other visual stimuli. Efficient tracking skills are required for effective scanning, which develops some eye muscles. Ways to encourage scanning: search for particular items in the environment, like I Spy with my little eye. Motivate the student to scan a room for a particular space, with or without additional aids. Matching games, sorting and grouping will assist scanning and recognition. Finding a particular letter within a sentence or paragraph. Place a small number of objects on a student's desk and observe their scanning pattern, left to right or other. Sport and physical education. The following information has been adapted from a document called Inclusion in Sport and Physical Education for Students with Vision Impairment, a resource for educators. It was written by Ryan Jones, who works for Guide Dogs New South Wales ACT. PE skills are often taught through physical demonstrations by the teacher. If a student with low vision or blindness cannot see the demonstrations, then alternative methods of instruction will need to be used. Physical modelling. At times, the complexity of a new movement might mean that detailed verbal instructions might be inadequate. The student will need to place their hand on the person giving the demonstration. This person could be a teacher or peer. For example, learning how to pitch a softball, the student places one hand on the forearm and one on the elbow as the action is completed. Physical guidance. Occasionally, physical guidance might be needed. The teacher or peer manipulate the student through physical contact. Of course, ask permission first and give verbal notice before contact is made. The physical contact should then be removed as soon as possible and replaced with detailed verbal instruction. Peer tutors. Provide tutoring experiences for as many peers as possible. Rotating peer tutors prevents the tutors from tiring and provides a wider range of social interactions for the student. Training the tutors helps them to gain a greater understanding and empathy for students with low vision or blindness and improve their formal PE skills. Reward the tutors by praising them and ensuring they feel valued for the contribution they are making. Instructional techniques. Walking and running is a great place to start. Depending on the student's confidence, support may be needed. Students with low vision or blindness may benefit from physical or verbal guidance when working towards confident, free movement. Students respond differently, so here are some suggestions from Ryan Jones, New South Wales ACT Guide Dogs. Elbow hold. Hold the elbow of a guide, a good place to start, which offers a high level of guidance. Cane hold. A cane or a stick can be held horizontally by the student and the guide. This is a good way to move away from physical contact. Reciprocal arm swing using two poles. This is a fun way to encourage correct arm movement. Guide ropes. Guide ropes with tubing to hold on to will allow a high level of independence. Tie knots at the end of the ropes to alert the runner they have finished. Running tethers. Running tethers can be made or purchased and are a good solution for running longer distances with relative freedom and no physical contact. Please note that the guide has to be behind the runner when they cross the finish line. Verbal guidance. Once confidence is gained, some students might prefer to use a caller to provide verbal guidance. Prerequisite skills. Students with low vision or blindness might have decreased opportunities for incidental learning. Start with a solid base of skills, for example, jumping, throwing, and catching, before moving on to sport-specific tasks. Make time to teach these skills, preferable to teach the skills prior to the lesson so the student is not removed from the class. Adapt the rules. Adapting the rules of the game promotes inclusion for all students. For example, when playing softball, a batter with low vision or blindness might prefer to hit the ball off a tee rather than have the ball pitched. Adapt the equipment. The nature of the student's vision should inform the adaptations required. For example, choosing a bright coloured ball may work for a student with low vision, whilst a ball with bells inside would be preferred for those without functional vision. Adapt to the environment. Environmental adaptations can take many forms. For example, boundaries can be marked with bright cones or made tactile by using a rope. Try a wireless doorbell as an auditory cue in target or goal sports. Place the bell on the target or goal and press the button to sound the chime as a student is aiming. Portable music speakers can also be effective in providing auditory cues. Case study example, basketball. Taylor is 13 years old with no functional vision. When planning a unit on basketball, Taylor's PE teacher followed these steps. Assessment. The PE teacher asked Taylor to demonstrate the way to dribble, pass, catch and shoot a basketball. Taylor had difficulty bouncing the ball consecutively and was unfamiliar with how to shoot. Taylor was able to complete a bounce pass with confidence, but had trouble tracking the ball when it was passed. Prerequisite skills. The teacher used a combination of detailed verbal instruction and physical modelling to teach Taylor the way to dribble and shoot for the basket. Time was allocated for this before class. A ball was also sent home with Taylor for practice. Adapt the rules. When it came to play, Taylor was still not confident with dribbling, so the rules were adjusted, allowing Taylor to take a maximum of 3 steps with the ball before stopping to bounce the ball once. All players were required to call Taylor's name and use bounce passes so Taylor could track the ball. Here, tutors took turns providing physical guidance on the court. Adapt the equipment. The school purchased an audible bell basketball that increased Taylor's awareness of ball movement. And adapt the environment. Long strips of carpet were laid around the boundary of the court, allowing Taylor to feel when stepping out of bounds. Wireless doorbells were placed at the top of the backboards to provide audio targets to aim for when Taylor was shooting for the basket. So having the diagnosis of the vision condition is a very good starting point to get a greater understanding of the student's functional vision. Remember that a functional vision assessment can be completed by the Education Low Vision Assessment Centre, LVAC. The clinic evaluates the implications of the vision condition and establishes the level and use of each student's functional vision in the learning environment. At Guide Dogs Queensland, we assist you to improve access to and participation in curriculum and the educational outcomes for students with low vision or blindness. Contact us on guidedogsqueensland.com.au 07 3500 9060 sdss@guidedogsqueensland.com.au. The next webinar addresses the adjustments that can be made for students in the school environment with low vision or blindness to improve access to and participation in curriculum and the educational outcomes. Remembering that the ideas for students with low vision or blindness can benefit other students in your class too, even if they do not have low vision or blindness diagnosed. Thank you for taking the time to join the webinar today. It's because of you that children with vision loss will feel more included in their learning environment.